So my name is Justin Bladman.
My name is Dr. Tanya Schramm.
Ko jai tamate toko ingoa no Ngāti Manipoto, Ngāti Kahanunu hoki. My name's Jay Tamatia.
Kia ora, my name's Monique McKenzie.
O tēnā koutou katoa, ko Casey Tāwhara tōku ingoa. My name is Casey.
Hi, I'm Dr. Simone Liddy.
My name is Sandra Hutu.
My name's Nari Blow. I'm currently a public health registrar.
I work at RFDS in Broken Hill. So my area of specialisation is GP and anaesthetics. The reason why I chose that was, as a student, a lot of my supervisors had either done GP obstetrics or GP anaesthetics. I had quite a particular interest in pursuing anaesthetics under the GP banner, and then ended up being offered a position in Broken Hill under that banner to do my JCCA training. So I took that up. That then obviously allowed me to pursue a career with RFDS, which is obviously where I am now, but also broaden my career options going forward.
I currently work as a general practitioner for Eastern Shore Doctors here in Hobart. I decided on this area of specialisation quite some time ago, simply because I was a bit undecided that there was any one specific area of medicine that I wanted to concentrate on. General practice would give me the ability to do a bit of everything, I guess, and I really quite enjoyed doing women's and children's health and mental health, as well as I love the idea of being able to have good, strong connections with families, being able to look after multi-generational families, welcome new babies into families and watch them grow, I think is a really amazing part of general practice.
I'm an endocrinologist and a senior lecturer at the University of Auckland. So I decided on endocrinology and physician medicine. I think I always knew I was going to be a doctor. That was something that was quite clear from when I was young. We were raised to understand the need to serve the community, and I think that this specialty has ended up being one where I can do that to the best of my ability.
I'm a dermatology trainee in New Zealand. My interest in skin started at a really young age, and it was probably when I was a teenager and noticed my first pimple actually, and my acne ended up being quite bad, and that was my first interaction with a dermatologist, going to get treatment for that. My mum, she had like a clothing label and a clothing store, so I spent a lot of time with my nose in fashion magazines, looking at the beauty pages and going to fashion shows and fashion shoots. So that's where my appreciation, I think, and interest in the aesthetics of skin started.
I am an obstetric and gynecology registrar. I chose this area of specialisation because it was a specialty that I clicked with in medical school. My mother is a midwife, so I did have some background in maternity and caring for hapu mama or pregnant women. And I liked the mix of a bit of surgery and a bit of medicine. One of the reasons I proceeded with the program was a senior registrar. So one of my fears about obstetrics and gynecology would be that it was a busy training program and I couldn't have a family of my own. But she showed me, because she had 4 children, that you could.
I work as a general practitioner in Darwin at Danila Health Service. So my first degree was in pharmacy, and I completed a placement as a pharmacy student at Danila Health Service. I really enjoyed it there. I loved working with my own people, and I loved working in the general practice field. And as a pharmacist, I was really, it left me really wanting more and wanting to be able to have more of an overall care of my patients. There was one GP in particular who took me under his wing, Dr. James Stephen, and he did sort of whisper in my ear a few times about, Simone, why don't you think about becoming a doctor and coming back and working as a GP? And that was the first time that seed was planted, and I started thinking about studying medicine and furthering my study in medicine. My passion for general practice grew, and I got to meet a lot of really inspiring GPs along the way that helped me to make this decision.
I currently work as my appointment with public health training through the University of Melbourne and also through the Murdoch Children's Research Institute. So I sort of headed towards public health training and decided on that area of specialisation because I realised that that was really where my passions lie. I really, when I was studying medicine, my focus was really looking at the big picture and looking at the, social and cultural determinants of health. Public health allows you to work in areas that influence not just patient care, but also the broader context of health. So thinking about the policies that affect healthcare, thinking about the systemic structures of the healthcare services, and also being able to focus more on Aboriginal and Torres Strait Islander health at a population level. I wanted to make a change on a broader level. Yeah, and I just really like being around people who think about health in a holistic way. And for me, I've tailored my training around Aboriginal and Torres Strait Islander health, and I've also been able to work both in academia and in research institutions. And most recently, I've also been able to work in the Department of Health and Human Services and look at things at a policy level as well.
I'm a respiratory physician and a senior lecturer with the Department of Medicine. And the reason that I chose medicine is because I was always that way inclined at medical school. There were a number of people who were instrumental in encouraging me into medicine. Many physicians that I worked with were very compassionate and kind people, and I wanted to be like them, and I saw myself in them as well. And I was tossing up between infectious diseases and respiratory medicine, and I think and the thing that attracted me to those two specialties was that I quite liked the work. I did like the work, and particularly the variety of respiratory, but I think it were the people that worked in those specialties for the particular rotations that I did.
There are quite a lot of supports now available through the college. We have our own Indigenous registrars group that works to help to support registrars in through their training and help get them through their exam process at the end. We put together a bit of a policy about supporting Aboriginal registrars through their training, what that would look like and how to best support somebody through their training, taking into consideration the difficulties or issues that we as Aboriginal and Torres Strait Islander people might have along that journey.
Access to scholarships was a critical part of me getting through the course. I was fortunate enough to be able to access scholarships as a medical student, and being married with children. That was one of our main concerns, was obviously being able to afford to do the course, and also one through RFDS with a return of service attached to it, and then able to pick up smaller scholarships as I went through, but it was essentially the difference between doing the course and in some instances continuing the course, or not doing it at all. So it was quite a critical component as an older student, having a house mortgage and so forth, as well as a family to support.
I did get a grant during my training to go to a PRIDOC, or Pacific Rim Indigenous Doctors Congress. While there wasn't an Indigenous scholarship when I went through, I know that there is one now, and it's a very useful scholarship for both Māori and Aboriginal and Torres Strait Islanders in the College of Physicians. We've also been working in recent years on some strategic pathways for Indigenous trainees to make sure that we're attracting trainees, that we're helping to get pathways into physician training, supporting those trainees and making sure that we graduate more Indigenous physicians.
So I was lucky enough to get funding scholarships from both my iwi and also Otago University. So that helped me fund my way through uni and pay for all those 2-minute noodles really. And it just puts you on a more equal playing field, I guess, with other university students or medical students who might have come from more privileged backgrounds. Recently, I was lucky enough to get or be awarded the Indigenous Health Scholarship, and that fund will help me travel overseas for 2 years. So the very final part of our training in dermatology, we spend 2 years overseas at an international centre.
The college, RANZCOG, or the Royal Australian New Zealand College of ONG, does not yet have any specific scholarships for trainees. However, there are lots of training grants that people can access in general, be Indigenous or non. In New Zealand, we have Te Ora, or our Māori Doctors Association, so there has always been pathways that I could utilise through Te Ora.
So the specific pathways that are available to Indigenous GP registrars that we should know about, and that I first found out about when I joined as a GP registrar, is the Indigenous GP Registrar Network, or IGPRN. So IGPRN are a fantastic organisation that mainly focuses on exam workshops for our Indigenous GP registrars all over Australia. So we have twice yearly workshops where we all come together, and it's a really great way to be able to network with other Indigenous GP registrars, and also with GP fellows as well that are all Indigenous, and they help to support us in the workshop, provide us with a lot of exam support and techniques.
So RACP, the Royal Australasian, I think, College of Physicians, does provide a scholarship, which is the Indigenous Health Scholarship. And for that scholarship, you are able to get some of your training fees covered. You also gives you attendance to some of the conferences, but of course that's for anyone who wants to do physician training. So public health training is part of physician training. Important sources of support for me during training is having that mentor and supervisor that I can check in with regularly.
I went through a Māori and Pacific admission scheme to get into medical school. Within the college at the time, there were no specific pathways. All you had to do to get onto the specialty was to apply. However, while being in the college as a Māori trainee, I joined the Māori Health Committee, which is part of the Royal Australasian College of Physicians, and within that met a lot of other physicians and trainees who boosted my and were supports for me through my training. But the college currently offer Indigenous scholarships where they support or pay for college fees and for attendance of specific conferences.
So the specialisation, I think, made me a better clinician from a family point of view. I mean, what's important is that this has certainly given us opportunities, in terms of travel and being able to be involved in a different family. In terms of Lyme, there's AIDA and other support associations that we can access. It's also understanding some of the community dynamics, but also just being there. One comment that resonated with me when I started medicine was that it didn't matter if you were the first one, but just make sure that you're not the last one.
It means having a job that I love, that's secure, that I really enjoy, really helps to make sure that I can bring up a happy, healthy family with a mum who loves what she's doing and can act as a bit of a role model for my children. It's really important to have that, to find your pathway, to work out what it is in medicine. Not only is medicine what you want to do, but what is it within that you want to, that takes your interest, because I think finding out what it is that you love the most will set you up for the most rewarding career.
So specialist training has meant that I have a really privileged life. I get to spend a lot of time with patients in whānau, and I get invited into their lives, and hopefully I get to give them some benefit out of it along the way. But I guess with that comes a real responsibility. So responsibility to the patient and whānau themselves, but also to the wider community, ensuring that I use my voice to challenge some of the issues within the system.
For me, it means that I get to get up most or every day and do something that I'm really passionate about, and I'm really fortunate to be in a job that I love. Of course, there's some things that I don't love so much, like some early morning starts and working on academic research and papers and presentations into the small hours of the morning. But apart from that, it's a really a privilege.
So in my immediate whānau, I have my husband and I have 2 children, and it's meant that we have travelled around New Zealand for different rotations. It's meant as an extended whānau, we've relied lots on my little village to help raise my children in the past. It's been really fulfilling at work and outside of work. It's connected me to my mum in a different sense because she's a midwife. I'm training in obstetrics. Being a Māori obstetrics and gynecology registrar has meant that I've been able to connect to my patients, my Māori whānau, in a way that I think is special to being a Māori trainee. And I think that's a real advantage for my training. And I've had some really meaningful ongoing relationships with women that I've looked after in the past.
I'm very proud to be able to say that I'm a GP fellow. I'm also even more proud to be able to say that I'm a Aboriginal GP fellow working in my hometown. My grandparents were part of the stolen generation, and I know that it's brought a lot of pride to my family to be able to have not just a doctor but a GP as well, working in our own home.
The other thing that is really important to me, aside from family, is that I can contribute to health equity for Māori and Pacifica in living in New Zealand.
What's important to me is actually doing the work that will contribute to changing health outcomes for my own family, my own community, but also broader communities of Aboriginal and Torres Strait Islander people. And I believe that public health medicine and preventative medicine, which is the main focus of public health, is something that is beneficial for all communities and all groups in Australia. And so that's sort of what it means to me in terms of specialising. But at the same time, I do believe that a lot of us are doing this work already, and there were people before us that have been doing this work. So yeah, that's essentially, public health is really just about working with everyone as a team to actually contribute to better health outcomes, both in prevention and long term.